You probably climbed into bed last night without thinking twice about it, rolled into your usual position, closed your eyes, and drifted off. But while you were unconscious, something was happening inside your blood vessels that you never felt, never noticed, and were never warned about. One sleeping position is silently compressing a major vein in your body every single night. And the damage builds so gradually that by the time symptoms appear, the injury is already done. In the next few minutes, you're going to learn which position cardiologists are now flagging as a serious concern and exactly how to correct it before tonight. If you fall asleep on your right side, you need to stop doing that immediately. I'm not exaggerating. That position you default to every night, the one that feels perfectly natural, may be forcing your heart to work overtime for hours while you have no idea it's happening. And here is what concerns me as a cardiologist who has spent 20 years studying vascular events during sleep. Nearly 1 in 3 strokes occurs between midnight and 6 o'clock in the morning, not during a stressful meeting, not during exercise, but while you are lying still in bed, completely unaware. I'm Dr. William, and over the course of this video, I'm going to walk you through 5 sleeping habits ranked from concerning to dangerous. But more importantly, I'm going to give you 2 specific positions backed by clinical research that can protect your brain and your heart starting tonight. Before we get into the list, I want to know where you stand. Drop a comment right now. Are you a back sleeper, side sleeper, or stomach sleeper? Because within the next 60 seconds, I'm going to tell you whether your nightly habit made this list. And if you're over 55, what I'm about to explain is no longer something you can afford to ignore. Number 5. Lying completely flat on your back with no head elevation at all. This one catches people off guard because it feels like the healthiest position. Your spine is aligned, your weight is distributed evenly, and plenty of wellness blogs recommend it. But your cardiovascular system tells a different story, especially after the age of 60. When your body is perfectly horizontal for 7 or 8 hours straight, blood migrates toward your head. Gravity is no longer assisting drainage, it's encouraging accumulation. In a younger person with elastic, responsive blood vessels, the body compensates without issue. But as you age, arterial walls stiffen and the small vessels feeding your brain become more fragile. And when blood pools inside your skull for an extended period, intracranial pressure climbs. That throbbing headache you sometimes wake up with at 3 o'clock in the morning is not random. That is pressure building inside your cranial vault because excess blood volume is not draining efficiently back toward your heart. Research published in the Journal of Clinical Sleep Medicine examined this exact mechanism. Their finding was clear. Even a modest elevation of your head around 15 degrees measurably reduces that pressure and improves venous return to the heart. Here is the pattern I see constantly in clinical practice. A patient wakes up dizzy. They swing their legs off the bed, stand up too quickly, and everything tilts sideways for a moment. They blame age. They blame dehydration. But what actually happened is that blood flow regulation failed overnight because of flat positioning, and their brain is playing catch-up the moment they go vertical. The correction is straightforward, and I'll walk you through it after we finish the list. But you need to hear number 4 first, because this one surprises almost every patient I tell it to. That stiff neck you wake up with every morning, paired with a dull ache at the base of your skull, is not just muscle tension from sleeping in an awkward position. That is restricted vertebral blood flow, and your body is telling you something is wrong at the structural level. The Journal of Manipulative and Physiological Therapeutics studied how cervical positioning affects vertebral artery flow. Sustained forward neck flexion measurably reduced blood supply through these vessels. I see this pattern in my practice more often than you would think. Someone complains of chronic morning headaches and neck stiffness. They cycle through pain medication, physical therapy, and new mattresses. Then they replace their pillow stack with a single contoured cervical pillow. Within 10 days, the headaches disappear. One pillow. That was the entire intervention. But we're only at number 3. Number 2 is where I start getting genuinely concerned for my older patients. Number 2, sleeping in a tight, curled fetal position all night. This is one of the most common sleep postures across every age group, and it feels instinctively protective. Knees pulled up, chin tucked down, arms folded in. But from a physiological standpoint, this position creates 2 separate problems that compound each other. The first problem is respiratory. When you curl tightly with your knees against your chest and your torso bent forward, your rib cage becomes compressed. Every breath you take in that position is shallower than it should be. You are not getting full lung expansion. You know that sensation when you first wake up and cannot seem to take a satisfying deep breath, like your chest is locked? That is because your lungs have been operating in a restricted state for hours. When oxygen intake drops even modestly, your blood oxygen saturation follows. For someone managing cardiovascular conditions or early-stage pulmonary disease, this reduced oxygenation puts measurable strain on both the heart and the brain throughout the entire night. The second problem is vascular. Your neck and upper back remain in constant flexion. The muscles along your cervical spine stay contracted for hours. Small blood vessels around the base of your skull get squeezed. Blood flow to your brain decreases in exactly the same way we discussed with pillow stacking, but now the compression comes from your own body position rather than an external object. Research in respiratory physiology and neurobiology demonstrated that body positions involving significant spinal flexion reduce tidal volume, the amount of air you pull into your lungs with each breath. Across an entire night, that deficit adds up to hundreds of compromised breaths. Someone wakes up feeling foggy, maybe with a dull ache behind their eyes, a little unsteady when they first stand. They assume they just slept badly. What actually happened is that their brain was operating on a reduced oxygen supply for 6 or 7 consecutive hours, and it is still recovering when the alarm goes off. The fix is not complicated, and I will show you exactly what to do when we reach the solutions. But first, we need to address number 1, because this habit combines multiple cardiovascular risk factors into a single nightly routine. And if you do this regularly, you need to change it tonight. Number 1, going to bed within 2 hours of eating a large dinner or consuming alcohol. I know this one hits close to home. Evening meals with family, a glass of wine to unwind. It is woven into daily life. But from a cardiovascular and cerebrovascular standpoint, this is the most dangerous combination on this entire list. Here is the mechanism. When you eat a substantial meal, your body diverts a significant volume of blood to your gastrointestinal tract to support digestion. That redistribution is normal and temporary, but it means less blood is available for your brain, your heart, and other critical organs during the hours immediately following that meal. In a younger person with healthy vessel elasticity, the body manages this redistribution smoothly. In an older adult with narrowed arteries or reduced cardiac reserve, the blood supply deficit to the brain can trigger dizziness, lightheadedness, or pre-syncope episodes during sleep. Now, layer alcohol on top of that. Alcohol is a vasodilator. It opens blood vessels and causes a sudden drop in blood pressure. For someone with flexible, responsive arteries, this feels like relaxation. But for a senior with atherosclerotic plaque buildup or stiffened arterial walls, that sudden pressure drop sends the body into compensatory overdrive. Blood pressure spikes to correct the drop, then crashes again. These volatile oscillations stress vascular walls and create conditions where small clots can form. All of this is happening while you're unconscious and unable to respond. The American Heart Association has published extensively on the relationship between alcohol consumption and disrupted nighttime blood pressure patterns. Even moderate drinking close to bedtime interferes with a natural blood pressure dip that should occur during healthy sleep. When that protective dip fails to happen, overnight cardiovascular strain increases significantly. Picture this scenario playing out in real time. Someone finishes a large pasta dinner at 7:30, has 2 glasses of red wine, and goes to bed at 9:45. At 1 o'clock in the morning, they jolt awake with a pounding headache, their heart hammering, sheets damp with sweat. They assume it was a nightmare. It was not a nightmare. That was a circulatory crisis. Their body was scrambling to stabilize wildly fluctuating blood pressure, while their brain demanded more oxygen than their compromised vessels could deliver. Over months and years, these episodes leave damage behind. Small vessel injury, microhemorrhages you never feel, silent infarcts that chip away at cognitive function without producing obvious symptoms. Until one night, the event is no longer silent. If you take nothing else from this video, change this habit. Finish your last meal at least 3 hours before you plan to sleep. If you drink alcohol, allow 4 to 5 hours of clearance before lying down. After dinner, walk for 15 minutes. Just gentle movement through your neighborhood or around your living room. That alone moves blood back into general circulation and can reduce your overnight stroke risk more effectively than several common medications. Those are the 5 habits to eliminate. Now, here is what you should be doing instead. The first recommended position is left side sleeping. And I'm going to share something with you that even many of my colleagues in cardiology haven't fully absorbed yet. Your heart sits slightly left of center. When you sleep on your left side, gravity works with your cardiovascular system instead of against it. Blood returns to your heart more naturally. Your heart generates less effort per beat. Your brain receives more consistent oxygen delivery throughout the night. That is the basic cardiac physiology. But here is the part that changes the entire conversation. About a decade ago, neuroscience researchers identified a system called the glymphatic pathway. Think of it as your brain's overnight cleaning crew. While you sleep, this system flushes out metabolic waste, including proteins like amyloid beta and tau, the exact proteins that accumulate in Alzheimer's disease and form the plaques associated with cognitive decline. A study published in the Journal of Neuroscience demonstrated that this glymphatic clearance system operates most efficiently when you sleep on your side, with particular advantage on the left side. Every single day, your brain generates these waste proteins as a byproduct of normal function. In a healthy brain, the glymphatic system removes them during deep sleep. But if your sleeping position restricts that clearance process, those proteins begin accumulating, not overnight, over years, over decades. And by the time clinical symptoms of cognitive decline emerge, the structural damage has been building silently for a very long time. Left side sleeping optimizes this waste removal process. You're not just protecting yourself from a stroke tonight. You're investing in cognitive function 20 and 30 years from now. There's a practical bonus as well. The anatomy of your stomach and esophageal junction means that left side sleeping keeps gastric acid where it belongs. You wake up without that burning chest sensation that drives so many people to stack pillows in the first place. If you've been sleeping on your right side or your back for decades, this adjustment takes time. The practical solution is a full-length body pillow. Position it in front of you and hold it. It stabilizes you on your left side, supports your shoulder and spine alignment, and if you have hip or knee discomfort, place a smaller pillow between your knees. One question I hear from patients every week is, what if I roll over during the night? You will. That is completely normal. Your body shifts position dozens of times per night, and you cannot consciously control that. The objective is not perfection. The objective is spending the majority of your sleep hours in a protective position rather than a harmful one. But there is a second position that works exceptionally well for certain people. Let me walk you through it. The second recommended position is back sleeping with gentle upper body elevation, not lying flat, not sitting upright, a gradual incline that raises your torso between 15 and 30 degrees. You can achieve this with a foam wedge pillow designed for this purpose, an adjustable bed frame, or even a carefully arranged set of firm cushions. But the critical detail is that your entire upper body elevates together, not just your head. Bending only at the neck recreates the exact vertebral artery compression we discussed with stacked pillows. This position works for three specific reasons. First, blood returns more efficiently from your lower body back to your heart. If you deal with poor circulation, swollen ankles at the end of the day, or visible varicose veins, this position assists your cardiovascular system during the hours when it should be recovering, not struggling. Second, intracranial pressure decreases. For anyone with fragile cerebral vessels or blood pressure that resists consistent control, this gentle elevation reduces the risk of small vessel rupture inside the brain. These microhemorrhages rarely cause dramatic symptoms, but they accumulate over time and contribute to vascular cognitive impairment, sometimes called vascular dementia. Third, your airway stays more open. If you have mild obstructive sleep apnea, chronic nasal congestion, or sinus inflammation, this elevation reduces tissue collapse in your throat, decreases snoring, and improves oxygen delivery throughout your full sleep cycle. Here's the detail most people miss when they try this position. Place a small pillow or bolster beneath your knees. This preserves the natural lumbar curve of your spine and prevents lower back strain. The combination of gentle upper body elevation with supported knee flexion creates what researchers call a neutral gravity posture. It distributes mechanical pressure evenly across your body and minimizes strain on joints and blood vessels simultaneously. But I want to be direct about limitations. This position does not suit everyone. If you have moderate to severe sleep apnea, back sleeping can collapse your airway even with elevation. In that case, left side positioning is safer. If you have significant shoulder arthritis, the reduced pressure on your joints from back sleeping may bring relief. If you live with diagnosed heart failure, left side sleeping is typically the better choice. The point is not to follow a rigid rule. The point is to understand why each position affects your body and to choose the one that matches your specific health profile. Have you tried either of these? Drop a comment below and tell me. Left side or elevated back? I want to hear what's working for your situation. Now, we need to talk about your bedroom itself, because even the perfect sleeping position cannot compensate for an environment that is actively working against your recovery. Temperature is the first variable. Keep your sleeping room between 64 and 68 degrees Fahrenheit. A cool environment triggers your core body temperature to drop, which initiates deeper sleep stages. It also reduces nighttime blood pressure naturally, taking strain off cerebral blood vessels during the hours when they are most vulnerable. A warm room keeps you cycling through lighter sleep phases, where your heart rate stays elevated and genuine restorative sleep never fully engages. Next, eliminate blue light exposure from screens after 9 o'clock in the evening. The blue wavelengths emitted by phones, tablets, laptop screens, and bright overhead lighting suppress melatonin production in your brain. This delays the onset of deep sleep stages, the exact phases where your glymphatic system clears metabolic waste and your cardiovascular system recalibrates. Third, invest in proper cervical support. A single memory foam pillow with a contoured cervical ridge supports your neck's natural curvature without forcing your head into angles that compress vertebral blood flow. This one change, eliminating the pillow stack and replacing it with a single purpose-designed pillow, resolves chronic morning headaches in a remarkable number of my patients. Finally, address overnight noise disruption. Sounds that never fully wake you still yank your nervous system out of deep sleep for brief moments. Your heart rate spikes, cortisol floods your bloodstream, and your vascular system absorbs that stress response. You won't remember these microarousals in the morning, but your blood vessels register every single one. A white noise machine or quality earplugs create the consistent sound environment your autonomic nervous system needs to remain in deep recovery. If you want to go further, track what your body is actually doing while you sleep. An overnight pulse oximeter, a small clip that sits on your finger, monitors your blood oxygen levels hour by hour. If your saturation repeatedly drops below 92% during the night, that is a meaningful clinical finding worth discussing with your physician. A smartwatch or sleep tracking ring can measure heart rate variability overnight. Low variability signals that your nervous system is under strain, your body is not recovering, and inflammation markers are likely elevated. Even a simple journal where you note how you feel each morning, whether you woke with a headache, any dizziness when standing, any tingling in your hands or feet, any unexplained brain fog, can reveal patterns that would never surface in a single 15-minute office appointment. These tools give you data.
Data gives you awareness. Awareness gives you leverage in conversations with your doctor that lead to better outcomes. I want to be clear, these monitoring approaches support medical care. They do not replace it. If you notice persistent symptoms or concerning patterns, bring that data to a qualified healthcare provider. Now, let me tell you why you've probably never heard any of this from your own physician. Sleep positioning does not have a billing code. There is no lab test for it, no imaging study that evaluates how you lie in bed, no pharmaceutical intervention that a doctor can prescribe and follow up on. In a packed 15-minute appointment focused on reviewing blood work, adjusting prescriptions, and managing acute problems, the conversation about how you position your body during sleep simply never happens. But the research is accumulating. Sleeping in certain positions can measurably influence blood flow, oxygen saturation, intracranial pressure dynamics, and your brain's ability to flush toxic proteins. These are not dramatic single-night events. They are cumulative processes that build quietly across years and decades. For anyone over 55, for anyone managing hypertension or cardiovascular conditions, these overnight variables become clinically significant. And here's the part that should genuinely encourage you. You do not need a prescription for any of this. You do not need expensive equipment or specialist referrals. You need awareness and one or two targeted adjustments to how you sleep. Pick one change from what we covered today. Maybe you switch to left-side sleeping with a body pillow tonight. Maybe you stop eating within 3 hours of bedtime. Maybe you swap your pile of pillows for a single contoured cervical support. Start with one change. Commit to it for 7 days. Pay attention to how you feel each morning. Notice whether headaches decrease, whether you feel sharper by mid-morning, whether that unexplained dizziness stops showing up. Your body will confirm whether the adjustment is working. Tell me in the comments which change you're making first. Your answer could help someone else in this audience recognize a pattern they've been living with for years without connecting it to how they sleep. If this gave you information you've genuinely never encountered before, share it with someone who needs to hear it. Someone over 60, someone managing blood pressure, someone who keeps waking up at 3 o'clock in the morning with symptoms they can't explain. And here is why you need to subscribe to this channel right now. Next week, I'm releasing a video on 4 specific foods that peer-reviewed clinical trials have linked to measurable reductions in stroke incidence. Not vague dietary advice. Specific foods, specific quantities, backed by specific research. And here is what makes it interesting. You almost certainly have at least 2 of them sitting in your kitchen already, but you're consuming them at the wrong time of day for the protective effect to work. This is the kind of clinical detail that will never come up in a standard doctor visit, but it could meaningfully change your vascular health trajectory over the next decade.
Hit subscribe and turn on notifications, because if what you learned today was valuable, next week's information builds directly on top of it. Sleep smart. Protect your brain. I'm Dr. William, and I'll see you in the next one.